everyone, welcome back to Midwife Par Excellence. I am so excited to see you. Happy holidays and a happy new year when it comes. I know that 2020 has dealt some of us a raw deal, but I decree and I declare that 2021 will be a better year for you. All right? Yeah, we hold strong to that. A better year is coming in 2021. Come what may, we will be ready and we remain resilient. We're doing this, right? All right, so today I will be talking about what to expect after you've had your baby. So, first, I want to say congratulations to everyone, to the mothers, the fathers, the grandmothers, the grandfathers, brothers, sisters, aunties, uncles, godmother, you name it. Congratulations to everyone. All right, so you've had your baby. They told you that, okay, you can go home, you're free to go home, you're discharged from hospital, you're discharged from your facility, wherever you delivered. All right, first thing you want to remember, it is important that you go to your nearest health center at 6 days post-delivery for your 6-day visit. All right, the only persons that are not expected to visit their health center for 6 days are those persons, depending on the area that you live in, the nurses normally come and do your 6-day visit at home or home delivery clients. And I'll be talking about home delivery in another post to come. Yes, I am very passionate about home delivery. All right, so we'll talk about that later on. So other than that, the other ladies, you are expected to visit your health center, nearest health center to your home 6 days post-delivery. Now, for whatever reason, you might not have your baby with you at 6 days. It is important that you still visit your nearest health center, ladies, okay? If at 6 days you are still admitted in the hospital, once you've been discharged, you reach out to your midwife or your nearest health center to see if they will need to see you or they will give you an appointment for your 6 weeks clinic to come. Now, you are at the health center, you're expected to bring your antenatal book. You're expected to bring your first urine in the morning. All right. Now, when you get to the health center, we'll be doing your vital signs, namely your blood pressure, your weight, your urine. We're doing your pulse rate, your respiratory rate, your temperature. We'll be doing all of that. A full head-to-toe assessment must be done on all mothers. Once you have reported to your 6-day clinic, a full head-to-toe assessment must be done on all mothers. All right, so we're checking the eyes to rule out anemia. We're checking the breast for engorgement. We're checking to see if the mother is secreting. If she's not secreting, we're looking at the nipples to see if they're adequate or inadequate for breastfeeding. And bear in mind, ladies, remember we encourage exclusive breastfeeding, and this is breastfeeding giving the baby nothing but breast milk with the exception of the Panadol pain and fever, all right, or the cetamol for the first 6 months of life. So baby shouldn't be getting any water, any juice, any gripe water, none of that stuff. All right, breast milk, once you are being told that you can breastfeed, there are some persons that are unable to breastfeed, but once you have been told that you are okay to breastfeed, please, I encourage you to do your exclusive breastfeeding. All right, we'll be checking the abdomen to see if involution is taking place, and this is the return of the uterus to its humble place of abode before you became pregnant in the pelvis. All right, if you have done a cesarean section, we're going to be looking at the area of operation to see that it is clean, it is intact, it's not oozing blood or pussy looking. All right, now we're going to the vagina. Whether you get a laceration, an episiotomy, a bruise, or if all was intact, we still need to look at the area. We need to look at the amount of bleeding. Is it minimal? Is it excessive? We need to look at the suture area if suturing was done to ensure that it is intact. We need to see if there's any foreign object left in the vagina that should not be there. All right. So we're looking at an overall assessment of the mother to rule out any form of abnormalities. Also, ladies, at 6 days, we're going to be exposing you to a family planning method of choice at 6 weeks. So at 6-day clinic, we would tell you about the method, so you would have had 6 weeks to think about it and if possible, accept a method at 6 weeks clinic. Now remember, at health center level, we have the copper T, which is the IUCD, which is placed in the uterus, and it can remain there if left undisturbed for about 12 years. Remember, we have the pills. You try to take a pill every day at the same time to prevent pregnancy. We also have the injection, which lasts for 3 months. It is to prevent ovulation. It also thins the lining of the uterus, and it also thickens the cervical mucus. All right? And remember that with any other methods that you choose, we give you condoms, as you know it is the only method that will prevent you from a sexually transmitted infection. At 6 weeks clinic, we will be exposing you to a pap smear. So we want to tell you at 6 days that at 6 weeks you'll be doing your pap smear. All right, and this is a swab of the cervix to rule out cervical cancer. Certain sexually transmitted infections too can be detected on a pap smear reading. All right, ladies, remember, even though we said that we're going to be exposing you to a family planning method of your choice at 6 weeks, persons have asked me, so nurse, are you telling me that it's time to have sex at 6 weeks? No. At 6 weeks, some persons would have started ovulating already. Some persons, their period would have returned. Remember, it's the end of your postnatal phase. You're not sure when you're going to be ovulating, so you do not want to take any chances. All right, we have had cases where persons have reported at our 6 weeks clinic pregnant already. So we have to make sure that at 6 weeks you are prepared. All right, just in case you would have been ovulating. Yes, the period is not back as yet, but you are not sure if you're ovulating. So we want to make sure that you're protected should in case you should become sexually active soon after that. All right, so it is a person-to-person thing as to when you return to sexual activities. It's between you and your partner. All right, we just ensure that you are protected at 6 weeks just in case. All right, so we talk about head-to-toe assessment. We talk about your pap smear. We talk about family planning. Now we move to the baby. Now we do a full head-to-toe assessment on the baby also. We're checking the fontanelles, and these are some openings, one at the front and one at the back. Over time, they will close. All right? Now we're looking at the baby's skin, the color of the skin. If there is yellowing of the skin or eyes, we know we want to rule out jaundice. Bear in mind that jaundice is very critical. We do not play with jaundice. Remember that prolonged jaundice can cause brain damage to the baby. Now we're looking for bluing of the skin, or if the skin is pink in color. Now the skin should be pink. That's the norm. If the baby's skin is blue, oxygen is lacking somewhere, and that baby must be seen immediately. All right, we're checking the abdomen. Is it flat? Is it distended? We're checking the umbilicus, and that is where the umbilical cord was attached to the baby during pregnancy. Is it healing nicely? Does it have an odor? Is it oozy, pussy looking discharge? Is it being cleaned properly? Umbilical cord cleaning will also be demonstrated to the mother if necessary. We're looking at the baby's genitalia, both male and female, to make sure that all is well. We're also checking to make sure that stool is coming from the anus and nowhere else. Remember, there's a condition called imperforated anus, where stool is coming from other places other than where it's supposed to be coming from, because unfortunately, those babies have no anus. All right, and that will be talked about in another post to come. All right, we're also checking different reflexes. All right, so you'll note that the midwife will be doing some checks. Feel free to ask questions as to why this is being done, or other things that you might have had questions about. Remember, the baby must be bathed. All right, nothing should be placed in the mouth in an effort to clean the baby's tongue. Remember that we understand the effort and you're trying to clean the mouth, but remember, whatever you're going to use to clean the tongue could have bacteria on it, and you put it in the mouth and then it causes more harm than good. All right, bear in mind that, ladies, you are special. You are special, and you will find that your midwives will tell you that you are special at intervals, because you really are special. You were given a privilege. All right, you have brought a blessing in this world, and we're very proud of you. Take your showers, Wash your hair, comb your hair. Your breasts are soggy for a reason. Your abdomen is enlarged for a reason. All right. Remember that postpartum depression is very real. Don't believe that you're alone, and this is another post to come in the future also. All right. Remember that you must reach out to your midwife or your healthcare professional if you have concerns. All clients must have a number for their midwife. All my clients have my number. All right. So it is very important that you have a number that you can call on just in case of an emergency. Ladies, continue to take your vitamins that you had during the pregnancy, and if they become finished, go to the pharmacy and get a multivitamin. Remember that you'll be lacking sleep at this time, and you must maintain your body in order to efficiently take care of your baby. All right, so ensure that you're eating, you're sleeping. For those persons who would have gotten a tear or an episiotomy during the delivery, you'll be told to do your sitz bath, and this is sitting in warm salted water for about 15 to 20 minutes per day for about 2 weeks or until the area is completely healed. All right, please ensure that you're doing your sitz bath. Whatever medication you would have gotten to take, ensure you have taken them in the correct dosage at the right time. All right, ladies, feel free, make your suggestions. You can call me at any given time you want. Message me, make your comments. Whatever it is that you need, your midwives are here for you. All right. My next post, I'll be talking about what to expect at your 6 weeks clinic. So until then, please subscribe, click the notification bell, share, tell a friend to tell a friend to tell a friend, and very soon I'll be having a large community with me. All right. So I thank you again for your usual support. Remember, take care of yourself, take care of your baby, and I'll see you soon.